Will the secretary please call the roll?
Director Deere?
Deere is here.
Director Harrington?
Present.
Director Robinson?
Present.
Director Story?
Present.
Chair Ryder?
Here.
And for the record, I believe Director Deere is present remotely. Director Deere, are you present remotely?
Dennis, are you there?
He's connected. Maybe he just left away.
Okay. We can see Dennis on the Teams meeting, but it's possible that he stepped away. So
I am here. Sorry about that.
let's see here. So we'll wait to do the motion to allow Director Deere to participate remotely until we hear him check
I'm
in.
here.
Director Deere, are you
I'm here.
present?
Yes.
Oh, you might be muted.
Can you hear me now?
For those playing at home, we can see something happening with Dennis's icon on the screen. So we'll just.
I'll connect with him.
Can you hear me
Okay.
now?
Connected.
All right.
Can you hear me?
Debbie, do we have any public testimony?
We did not receive any registrations, nor did we receive any written testimony.
Awesome. First item is
Can you hear me now?
the June 22nd, 2023 Finance Committee meeting minutes. These are approved by the board at the June meeting. They're being presented for the committee's review and discussion if necessary. Are there any corrections or changes that need to be made to the minutes? Any corrections or changes? Any corrections or changes? Hearing none, is there a motion to accept item 3A, the June 22nd, 2023 Finance Committee meeting? So moved. Motion's been made and properly seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye. Aye. Aye.
Can you all
The
hear me
ayes
now?
have it.
Can you hear me now?
Moving
This is
along,
Director
we have item 3B, which is a item regarding a proposed resolution regarding the pilot physician quality incentive pay program. And we are going to, consider this, I believe, at the full board meeting. So we're going to defer it to the full board meeting, which will be coming up, what is it? Next 2 weeks. And we're a little early. We're a little early for this committee this time around. So, so we will come back to that at the full board meeting. Next up is items under the Chief Procurement Officer. It looks a lot shorter on my cheat sheet because we grouped them. And we have joining us at the main table is Charles Jones, our Chief Procurement Officer. Charles, are you going to take us through these, or are we going to go with the executive sponsors?
No, sir, we're going to go to the executive sponsors.
And Charles, before you do so, apparently everybody on Teams can hear Director Deere, but we can't. So if someone else who is on Teams, like Andrea perhaps, can you test out your mic and see if we can hear you?
Sure, hello.
Hi, we can hear you. Director Deere, you want to try again?
Can you hear me?
We can hear you.
All right.
Awesome. I was here all the time, but my mic just didn't come through.
My good friend, Commissioner Deere is on the line. I know he's excited about the upcoming Deadpool movie that has Hugh Jackman in a traditional Wolverine costume. So
very much excited.
We will be catching up about that this afternoon, Dennis. Can I have a motion to allow Director Deere to participate in the meeting remotely? So moved. Motion's made. Is there a second? Second. Motion's been made and properly seconded. Any discussion? Hearing none, all those in favor signify by saying aye. Aye. Opposed? The ayes have it. All right. Charles, do you wanna, I think that would give you some ability to participate in this. Why don't you introduce the folks who will be speaking on the individual items?
Sure, we'll do. Well, first of all, good morning, Charles Jones, Chief Procurement Officer, Cook County Health. A little housekeeping first. 19 contracts today. All 19 require responsive letters from the Office of Contract Compliance. We have 9 back, so it's 10 outstanding. Okay. So, first up is Dr. Hashbrook, and I don't know if he's remote or not. I don't see him in the room, so we'll move down a little bit and then come back. We'll move to item 3 with Dr. Fegan. 3, 4, and 5.
Yeah, go ahead. Go on up there, Claudia.
So the first one is Lincoln Park Dialysis, and this is the group that provides dialysis for our patients who are detained at Cermak Correctional Health.
Voicemail, 9:10 a.m., plus green.
You want to go to the next?
Any questions on that one?
Any questions about that? Okay, thank you. And so the next one is for Schwab Rehabilitative Services. These are for our patients who are unfunded and are ready for discharge from acute care at the hospital, but may not be ready to go home, require acute rehabilitative services. So this is a contract that allows, we pay for the rehabilitative services in the hope of getting those patients to a place where they can go home, but if not, that they would then go on to a skilled facility. So this is a new contract to provide those services for those patients.
Any questions on this item? If not, Claudia, go ahead and move on to question number 5.
So the last one is for the Da Vinci robot. This is a opportunity for us to finally come into the 21st century to provide robotic surgery in our operating rooms. This will be used by multiple services. There is now the standard of care in terms of certain procedures that are performed by robots. This will be used by our OB-GYN, this will be used by urology, this will be used by general surgery. This will be a safer procedure for some of our patients, and we think less complications, so we're looking forward to this upgrade.
Fascinating device.
Yeah.
Any questions on this last one? Thank you, Claudia.
Thank you.
All right, Giles.
Ms. Shannon Andrews for 6 and 7.
All right. Shannon Andrews, our Chief Equity Inclusion Officer. Morning.
Good morning. I have 2 items before you today. They're companion pieces, actually. The first is a request to extend an increase with voice, with WEYI, doing business as voice. This request is for an increase of $860,000 and for an extension of 1 month, taking us through November 30th of 2023. This will allow for the completion of a procurement process to bring a new contract and to integrate new, potential new services into the system. The next item, and this is for video remote interpretation, the next item is for audio, strictly for phones and translation services, is for a request to extend an increase not to exceed $425,000. Again, the procurement that I spoke of previously will also address this need. The request is to extend for 5 months, which will align it with the previous contract and again allow for the completion of the procurement process and for the implementation of any new systems. If there are no questions, those are my 2. Thank you.
Thank you, Shannon. Next, we're going to move to items 8 and 9, right, Charles?
Yes, sir. Ms. Valerie Amos.
All right, Val. Our Chief Human Resources Officer.
Good morning, Chair Ryder and board members. This is Valerie Amos, Chief Human Resources Officer. The first contract before you is for Brazen Technologies. Brazen is a recruitment virtual technology solution that we have procured and utilized over the past year. We've hosted virtual job fairs utilizing this technology solution. It is one of the best in class, as well as hosted some interviewing blitzes, and we will host additional interviewing blitzes this particular month. So this contract value is for $52,009.10. The contract term is for 1 year, and so we are looking to renew and extend this particular contract for 1 year so that we can have, again, some options to support our recruitment process. In addition to that, we will be conducting more outreach to colleges and universities utilizing this technology solution so that we can support and talk with senior students at the colleges and universities to attract them to CCH. Questions?
I'm curious,
Yes.
on this particular, with this technology, have you seen it skew toward one demographic versus another?
That's a really good question. When we hosted 6 job fairs, virtual job fairs with this technology solution, we didn't necessarily see or track a particular demographic group. This solution has, so many features, though. Perhaps we can track it in the future.
Okay. I was just curious if it actually allowed you to get to, say, maybe a younger demographic versus a maybe not so old, but older.
We didn't necessarily see that. Again, we weren't tracking that, though.
Okay.
We really were not focused on that, but that's a really good observation. This technology solution does have like AI, so it would definitely probably lend itself to some younger groups as well. But we can certainly take a look at it a little closer as we continue to utilize the service.
Thank you.
No problem. Great question. The next contract is for Slalom. Slalom has been one of our external vendors, who have been here to support us through the HR optimization work. This particular contract, we are looking to extend it and increase, until December 31st, 2023. Slalom has been really integral in really supporting our infrastructure as it relates to HR. So as you know, they've come aboard and they've created optimization, digitization as it relates to data analytics, and they've assisted us with tracking and trending our acceleration of hiring initiatives. And so there's a lot of outputs that they have produced, but we definitely want to finish up some projects that they have outstanding with us through the end of this fiscal year. We have also submitted for an RFP intake process so that we can look at a more holistic support from an external vendor in the future if needed. Questions?
Any questions for Val on that? Thank you, Val.
Thank you.
Mr. Chairman, I don't have a question, but, this is, the work that Val and her team has been doing with, Slalom is really outstanding. I think it would be worthwhile if the entire body had an opportunity to hear a little bit more in depth about the success that, HR has had involving their work with Slalom. So maybe at the next board meeting, so that the other directors could, take advantage of what they've done, hear what they've done over the last year.
Yeah, I think it would probably be appropriate for the board meeting or the HR committee, so I would suggest the board meeting.
Okay, sounds great.
So thank you.
Thank you.
Thanks.
All right. You did a good job, Val, but you can't take the table with you. All right, Charles.
All right, request 10 and 11, Ms. Angela Banion, Chief Information Officer.
Morning, Angela.
Good morning, Angela Banning, Chief Information Officer. The first item, I have two. The first item before you is through our supplier, CDW, for a product known as Sexetta. This continues to support our human resources efforts. This is for onboarding, more efficient onboarding, more secure onboarding, primarily of our contingent and contractor staff. We have a contract already with Sexetta related to hardware and related to software. This allows us to continue with some of their services related to helping us with some of our workflow designs. The next item before you is our, we continue, of course, in the healthcare industry, like, probably like not many others, to extensively rely on paging. Our patients use paging to contact physicians, of course. We also have internally secure messaging. You may have heard of another solution that we're using, Tire Connect, but we also have as a backup method pagers for externals to contact us, and we also use it internally a bit. The reason this is sole source is because historically, Cook County Bureau of Technology held this contract, and they no longer use pagers in Bureau of Technology, which was primarily used to communicate with each other. So you can understand why they would not need pagers. They have cell phones and other things, and they were primarily interacting among themselves as employees. So once that contract expired with the countywide, we are assuming the contract for ourselves and having this extension, this particular contract with the extension allows us to assess our needs, including determining the need for a request for proposal.
Any questions?
Thank you.
All right, thank you.
Thank you, Angela. All right, request 13 through 19, Mr. Craig Williams, the Chief Administrative Officer of Operation and Development.
All right, Craig, good morning.
Good morning. Craig Williams, Chief Administrative Officer for Cook County Health. The first, item I have is from Mayo Clinical Labs. It's an increased contract for $205,000. Contract period ends 11/30/23. And this vendor provides, consultation on anatomic pathology cases and reference lab services. We're requesting an increase to pay invoices, through the end of the contract. So we've seen a little bit increase in patient volume, and so that this increase is related to, patient revenue. Next one is Cardozi Kuiper Design Group. This is an amended, extended, increased contract for $115,984. New contract period will be 8/14/23 through 8/31/24. This work is being done through CIP, and this firm is developing design for interior and exterior wayfinding and signage design at Stroger Hospital. We're actually in process of installing a proof of concept design across the professional building and first floor of Stroger so we can test out the broader ideas of this project. Okay, Hologic, it's an executed a 3-year contract for a total of $13,305,000. The contract period would be 6/1/23 through 5/31/26. And this vendor provides instruments, reagents, service, and collection kits, GYN and non-GYN cytology tests, along with molecular testing platforms for COVID, respiratory virus panels, and STI testing. The new contract will include additional instrumentation, along with a slide stainer for cytology, and will allow for additional testing on the Hologic instruments. Professional Clinical Labs is an execute contract for a total of $6,571,000. Contract period is 7/1/23 through 6/30/26. And this vendor provides our complete histology services for the lab. So what we do is we send our tissue blocks for processing, staining, and necessary genetic marker testing. Those slides are then returned to us for pathologist review and interpretation. They are our current vendor, but we did award this contract through an RFP process. GE Healthcare, this is an execute contract for a capital equipment purchase totaling $4,953,000. This is a one-time capital purchase to provide a PET CT scanner, including turnkey construction for the installation and renovation of the project, which includes both the PET scanner room as well as the uptake rooms related to that service. The radiology group is the next one. It's an execute contract for a total of $4.8 million. The contract period is 8/1/23 through 7/31/26. And this vendor will provide remote teleradiology services for after-hours stat exams. The vendor will be working with us, providing open communication between our medical staff, technologists, in consultation for exam reviews and discussions. Siemens Medical Systems, this is an execute contract for a total cost of $1,409,000. It's also a one-time capital purchase, and this vendor will provide 2 dedicated fluoroscopy systems, which are also capable of performing general radiology imaging. And this system will support both our inpatient and outpatient services, speed pathology, and our surgical and orthopedic service lines. One more. Abbott is a execute new 3-year contract for $372,000. Contract period will end 9/1/26. And this vendor provides bidirectional interface connectivity for point-of-care testing system-wide. The software transfers patient results directly into Cerner and captures quality control and testing data for our review. Yes.
Yeah, I have a question, not about anything that you presented, but when we replace the equipment, what do we do with the old equipment? In the general sense, particularly those things, those items that are very.
Some of it gets donated and some of it is part of the actual acquisition. So it really comes down to piece by piece. If there's an opportunity to trade that in and get a credit towards the purchase of the new equipment, we'll take advantage of that. If we can't do that, we look to donate that.
It'd be interesting just to know how much equipment we just get rid of and how much we get some compensation for.
Okay, we'll have to think about how we can provide that information, but I'll work with the finance team on that.
Yeah, there is a disposition policy that we look through that shows what happens to it, because it's valuable equipment that belongs to the Cook County Health System. And so we can go through how we market it, how that goes through. Some of it is processed for scrap metal, some of it is donated where appropriate. If there's a liability review that's also done, and then whether or not it can even be of usable service somewhere else. And so that goes through our dissolution process, but we can update the board and then be able to give some feedback on how the products are terminated and what the processes are for allocation. And as Greg said, a lot of the larger expensive equipment, you get a trade-in value, and so that's part of the agreements that we put in where possible.
Thank you.
Thank you. Any other questions?
Thanks, Greg. Okay, do we go back to number 1 and 2? I don't know if Dr. Hashbrook is joined or anyone from the Department of Public Health. If not, I'll do those 2.
Do we have Dr. Hesbrook on there?
Any representative?
Also, just one last thing, I wanted to make sure, because I don't forget, any donations that we give require county board approval as well. So if
Probably haven't had a lot of equipment.
it's usually computers, others, because it's usable. Most of it we either trade it back or it's processed.
Looking at the list that Craig presented this morning, it seems like it's been a while.
It has. I do want to note the investments that are being made, and so they will take us substantially forward. So we are very proud of the fact that we will be bringing 2 surgical robots on board, which will bring us to modernization. It's something we've been working for quite some time to make sure that we're moving forward. Also, being able to have our teleradiology services will make it much faster, and then our upgrading on our lab equipment, and then also upgrading our PET CT scans will definitely make Cook County Health and our facilities now fully modernized facilities with the latest technology. So, and correct, they were a little bit dated. So we want to make sure that we have the best for our patients. So thank you to the board for supporting us in doing this.
I have just another follow-up, but just to continue the discussion, is this an opportunity given robot that for us to push that out in the market, in the community?
Absolutely.
You know, in terms of, all of the things that, in particular, the robotic surgery and the PET, this is state of the art. This is putting us right with the rush, Northwestern, Chicago. And we build a marketing campaign around imaging.
We will. So as soon as they're put in place, we're always pleased that our vendors usually are very excited that they have gotten this equipment here, and they tell everyone through the large publications and trades. But we will be marketing our service lines and showing what we did, and then we'll be bringing them also to the board to showcase how they're leading to advancements like we did with cardiology. We'll be bringing our science, we'll bring oncology, all the elements that are part of the larger Change Institute collaborative to make sure that equity and care is met here at Cook County Health. And through equity, we mean that we are providing the same level of excellence that you would see at the Cleveland Clinic, at other top performing institutions is rendered here at Cook County Health. These are part of those investments to ensure that. So we will definitely be marketing it and letting the community know about the amazing things that are happening here.
So you said something very key when you started to make the comparisons. So are we offering something in this area that is not offered by any of the other major hospitals or systems?
So right now I would say that we're getting to parity, and then we are starting to provide, we are providing something onto other hospitals. What I can say that we do, especially in cardiology, and that we're very proud of, is that we are the only ones that we know of in our immediate region. I don't want to say that we've come everywhere to the country, but we're the only ones in our immediate region that provide these elective services to everyone regardless of ability to pay. And so that is where the equity comes in, is that especially advanced cardiac procedures that are often deemed elective that make the determination whether or not you can live a healthy life, continue to walk, breathe, be able to work. Those things are often not given because they're deemed elective. And most institutions are not, if you're not covered and you don't have the payment, you're not able to get that surgery and resume your normal life. That's why for us it's such a challenge, and part of the development of the Change Institute, and when we were showcasing some of our patients, is that these were patients who previously, without Cook County Health being here, would not have gotten those surgeries, and they're often deemed elective. And so those are the things that make the difference from some patients being able to live another 15, 20 years And so by bringing those services here, given our mission, you actually are doing something that no one else does, which is to provide those services to everyone regardless of ability to pay.
So now that brings me to what Director Story was actually stating. My question is, because we are doing such excellent work for that demographic, can we utilize that as a way to be able to expand and pull more of those people in that demographic to this location? Because it makes all the difference when you start looking at quality. And you can say, well, you can go over to these other places, but they don't offer you the same type of quality as well. And that seems like that's a very marketable trait. Again, I don't profess to be any marketing expert, but nevertheless, quality is quality.
Yeah. So we'll do two things. I would say in healthcare, marketing is special because it means to make sure that you have the access to accommodate the people that you're reaching. So we're building them together. And so we will be doing marketing campaigns, but how we get that capacity is that we've been talking about one of our newest projects called the Cook County Health Referral Network. And that's where we're taking our specialists to work with other facilities to increase access, to even work with other health systems to utilize our specialists, working with FQHCs, working with other locations where the specialists may not be available. And so we're working to have our specialists partner and to be available to take more patients from more locations, especially on the advanced services like neurology, cardiology, oncology. Those are usually going to get through primary care. And so we refer our own patients, but if you want to service more, you need to have those connections with other places where these patients may be. And so we're looking to have our services, our specialists, services expanded to some more locations through our referral network. We will be marketing our institutes to be able to show that we have them here. And part of our branding, in which we've started with the service lines, is we'll be creating a cardiac institute, we'll be creating a center for excellence on oncology, we'll be creating a neuroscience institute. That's why when you see some of the other systems, they always brand and say, we have this institute, this is where you can come. We'll be developing those same marketing strategies so that people know that we're here, we're available, and we'll treat them. And then we do lay an overlay of both earned media campaign, because the best is to have other people celebrate your successes as a way to get your name out there, and then our own media that we put out there. But in that also, we've talked about the One Source Enterprise project that is looking to revamp how people can access us. So whether it's by creating more pathways for people to do self-scheduling, by creating more avenues for people to connect and have their phone calls answered immediately, providing, we've been talking about looking at urgent care services available virtually and in person, making sure that people can get in right away. So that when you have the marketing in the field, if someone says, hey, I like that Cook County Health, I'm going to call them immediately that we can connect them. Otherwise, if you have that small window, so when you're on air, and airtime's expensive, or whether we're doing marketing media or others, if the connection doesn't happen, you're just wasting money. So our job is to make sure that we are ready to hook into that. So I always see the public media campaign is sort of like the frosting on the cake. We're building the cake. We're getting ready to start frosting. Soon we will be there, but we want to make sure that when you're up on air, we can absolutely make sure that it's a seamless patient care experience. So the patient care experience is being refined and honed, and we're getting ready to get to that moment. So we have some things that are already out there in the field. We have wonderful programs with our county care. We have public campaigns that we also use any opportunity we're on air to talk about. You know, before you saw us talk about COVID vaccination, we're getting ready now to talk about some substance use issues that will be coming up, and we'll be having other things that will be coming to the board. And then we'll do a full-fledged marketing. And even when we're doing our specialists, we're not going to waste the opportunity to talk about facts that people should know about oncology or neurology or science, because every opportunity is an opportunity to educate and to market, and we'll do both simultaneously.
Now, can you use that to increase or stop the loss with county care due to redetermination? I know that you can take any type of payer, but is there any way to make that be a benefit for county care?
I would say it's a sort of a two-part question, but I will answer one. Anything that involves marketing on redetermination in county care, we had to get state approval. So we do coordinate with the state. And what we have done individually, again, is to make enrollers available, to have hotlines available, to have all the information available in different languages, communicate that to our partners, to make sure we have people that are being outreached to let them know that they could be eligible, all within approved state plans. What we do is to make sure that we're still here, to make sure that care is not disrupted for anyone. And so through our CareLink program, anybody who gets disenrolled and who has a fear that they're not going to be able to get their care that they need that were previously available. We make sure that we have our care counselors here to enroll them in something, and if they can't, we have our fee scale and our charitable care programs that are available for those individuals. So we make sure that we have a whole package. We're educating and outreaching where we can, and for all the rest, we have a product that we try to enroll them in to make sure their care is not disrupted.
You know, one of the key things that I see in terms of marketing, some of this is anecdotal, but I believe that it would bear out, is I know someone who was a physician just over the border, would see patients, would see them come in with their county care insurance and say, you know, you have really good insurance and you know, county provides really good health care. You should really go either to Providence or go to Stroger and, you know, use their, you know, utilize the services there, and they could take care of you better than what we could do here, and you've already got the insurance. So I think having those physician referrals, whether it's someone from an immediate care or an ER, or, you know, someone that lives on the border territory, as I call it, I think is helpful. So it's people I think for us too, it's like the public awareness, all that is important. There's only so much you can do to compete with University of Chicago and Northwestern sponsoring, you know, Bulls games and things like that. The thing that really makes the rubber hit the road is physicians and people in the medical community recognizing the growth that we've had. And I think after the growth that we had, the pandemic related growth, I mean, seeing how our numbers are bearing out, I think is showing how we're making the transition, we're stabilizing, right? And we're building the foundation for like the cardiac programs and other things. Like Bill Hammock used to tell me, I don't use county for dentistry, but he was always a big fan of the dental program that we have here. So it's definitely marketing in this space is a little different than what some of our competitors are, you know.
And one of the
I would argue we don't have competitors based upon our mission. I want to get back to the mission, and Israel mentioned that our mission is really to serve everyone regardless of ability to pay. And so the key point that he made for me, and probably the most cogent point, is we serve everybody regardless of ability to pay. And that means that's uncompensated care, and there is a cost for uncompensated care. We're a public system. We're here to serve the public. I think the big argument for me is that our quality is second to none. That you can get the same quality of care here at Stroger and Providence you get at any hospital in any academic medical center in the city of Chicago, the county of Cook. And that's the big issue for me, because ultimately we are here to make sure that no one goes without the health care they need. People that have insurance and people that have money have options that other people don't. And one of the populations we serve that others do to a degree, but not to the degree we do, are people that don't have the ability to pay, and that's why they come here. But I do think our quality is something that we can push, and our ability to provide the same services moving forward is very important.
I wholeheartedly agree with you. My questions are geared toward helping.
Yes?
Go ahead. I was going to say something, but
Okay. Well, why don't you go ahead, because we've all been sucking the air out. We're going to need to move on. I think we've gotten off of the contracts too, so we're going to need to rein it in. So Dennis, why don't you say something, and then I think we're going to move on.
I think this was conducive conversation and very positive. I think that what's important is certainly quality, but I also think we need to do a campaign of education and improve our campaign of education of the great work that's happening at Cook County Health. I will tell you that in underserved communities, they don't believe Cook County Health is doing the great work that it does. They think it's free, and that's why they go, because it's free. Some people associate free with non-quality. So I think from a marketing standpoint, we have to do more interviews with people who have had successes coming to Cook County Health, so we can put a face to the great work that we're doing. One thing that Northwestern does is they have a successful transplant, you better believe that they're going to the media, for sure. So they put it out there. That's why people are flocking over there, because they're saying we're doing things nobody else is doing. Now, they may not be all true, but they're the ones that.
Yep. And I think that gets to the heart of what Joe was saying too, is that, you know, building confidence through our quality, and that's what, you know, Israel was saying. And, you know, I think making sure that we have our message out there, because I do agree. I misspoke earlier when I referred to the other hospitals as competitors. They're other hospitals, but they're not really competitors, because they're monetized, despite their tax status or their mission, they're monetizing everything, you know. So anyway, public health contracts.
Yes, so I would do request 1 and 2 on behalf of Dr. Lamar Hasbro, the Chief Operating Officer for Department of Public Health, in his absence. Number 1 is to increase the contract with Loch Ness Medical Supplies by $115,000 grant funded for the remainder of the contract period through November 30th, 2026. This is with execution of the overdose data to action grant with the Chicago Department of Health. The spender will expand the harm reduction through the addition of purchase of fentanyl test strips and xylazine test strips to respond to the surge of overdose that has involved fentanyl or xylazine. Any questions?
Any questions for Charles?
I have a question. I have a question about the procurement. Maybe Dr. Stevens, Dr. Gaddy said, and what is this modality? Is it something like the diabetes in the old days that you stick it in somebody's tongue if they're overdosing? What is this script that you're referencing?
The delivery
The test
method,
strip.
no, the test strips is used for,
Yes, so the test is to detect the fentanyl. So what's happening is that they are cutting other narcotics with fentanyl, and people can't tell how much is in there. So they think that they're getting cocaine, and they're getting a combination of
Cocaine and fentanyl, which will kill them.
They need to be able to detect it. And so we provide it, for example, at the public library, so that it's a free space, you know, non-judgmental, where people who are going to partake of particular narcotics can find out if there's fentanyl in what they use.
it's before it gets into the body.
Yeah.
So I always,
Probably a good idea, yeah.
it's a good point and a good question. I never want to waste an opportunity, especially as we're seeing a large epidemic of this happening. And so for anyone listening, right now what we are seeing, both at our health system and across all our points of care, is a large number of people suffering mortality because there is a belief that some drugs were safe, that you wouldn't immediately have mortality issues, which is incorrect. But now that has never been more incorrect than it is now. Right now, any drugs, including people think that they are using drugs that had traditionally been used that people thought were safer, and there's never safe, like marijuana, other drugs, they now are laced with these very potent things at sometimes unrecognizable doses. And so a few uses of this product can put you immediately at death. And so we are seeing a lot of patients come in and suffering from mortality and dying because people are using these elements to dose drugs. And so we just want to always communicate. The reason the test strips are important is because it's a way for people to just know what they're getting into. But the best thing is, one, not to use them, and to know that right now in our country, it is a very dangerous time for any use of these drugs because they are being laced with these products that can result in death, immediate death. And if we don't communicate that enough and take every chance, that's why we're seeing these outcomes. So it is important to anyone listening, to anyone available, that these drugs right now have never been more unsafe than they are at this moment because of the dosing of these elements onto these drugs. That we know and we are seeing in our hospitals, in our emergency departments, in our morgues, an increased number of people who have suffered death due to the use of them because they are unsafe. And it's important for people to know. We will be having other educational moments. campaigns and strategies to be able to help people understand and have resources available. But this is a very unsafe moment in our country, to the point that even the White House has declared this an issue that they are monitoring as an emergency level event in our country. So it is important that everyone knows that this is a very unsafe moment, and we do need to be taking steps to do that, and that these drugs can result in immediate death.
Why are they lacing it with it? I'm sorry, I'm extremely naive in this particular area.
Can I make a comment? We're talking about the difference between street drugs and prescription drugs. Drugs you go to your pharmacy and you pick up and you get. But people are buying drugs off the street from people that, who knows what they've done with the drugs before they sell them. That's a genuine problem.
They're cutting it with fentanyl just to increase what the.
Go ahead and set the table, Dr. Fee.
Claudia, can you come to the
table? Yeah.
microphone?
And introduce yourself, because I don't know if everyone heard your mic. We know who you are, but of course we.
I apologize. Claudia Segan, Chief Medical Officer of Cook County Health. So the thinking behind lacing these drugs with fentanyl is it increases the euphoria or the high, right? So a little bit may make it more potent or more intense, but it's an inexact science in terms of what kind of dose you're delivering, and so it can be a fatal dose, even the first time.
Okay, and the reason I'm calling this is because.
Yeah. Commissioner Deere said, well said.
Oh.
Yeah.
Because as you know, you go through the HR process and you're trying to hire folks, and in our state, marijuana is legal. So there are a lot of folks who partake, and as I understand it, there are a lot of folks who will go to a cannabis shop, but there are a lot of people that still will buy it off the quote unquote illegal market. So now all of a sudden when you say that and you say a couple doses will kill someone, that sounds extremely alarming.
It is. It's the point that Mr. Rocha was making, is that there's no such thing as a safe street drug anymore.
And I can see the purpose for giving out the strips, because if they have the problem, well, we know who's going to see them. And so now, and again, this is not sounding harsh, but from a business perspective, that's a way to do preventive care, because that cost that comes in, the person who's using it who may not have insurance, and we are a safety net hospital, we're going to bear that cost. And it only makes good financial sense to do that preventative work.
Absolutely, absolutely.
So we're just saying right now, and again, we want everyone to know there are no safe street drugs, to be very clear. You can, medications that are processed legally, FDA reviewed, those are still safe. But there are no safe street drugs right now because of this epidemic. And we're seeing it be very, very punitive across our country. And so it's important for people to know. We will be taking steps in educating and bringing back an updated campaign.
Are we able to get any federal funds for that? Because
as you can see, some of these are with grants. So we do have federal grants, we have federal funds. We have some funds that will be investing. And so this will be a collective that will be bringing some more details back to the board that is being organized right now. This is just one of the first few steps, and we applaud our public health department for taking steps to do this, but we'll be bringing in a coordinated campaign across all of our programs to show what we'll be doing.
I think it's, before we conclude, I think it's also important to note that these strips and the services we're providing to identify the fentanyl in the illegal drugs, street drugs, this is happening after someone's purchased the drug. It's not a way for us to, we're not facilitating someone finding a good batch of coke or heroin. You know, it's happening after the fact. So the person's already at their own expense. This is purely what you're suggesting, Sam, is that this is to mitigate the human and healthcare costs to our community by helping to save lives, and not to on the financial sense, to make sure that we're getting ahead of people having to come into the hospital because they're having an unfortunate incident. Joe?
Yeah, I just want to make one last statement, and I think it's a Greek term, caveat emptor. Let the buyer beware.
The other question I have is it possible, or does it make sense to coordinate with some of the other municipalities? Because we know you get a lot of people coming in from the western suburbs to purchase those illegal drugs. And if they have an incident here in our area, again, we find ourselves taking care of that problem, hopefully being able to solve it. So can they help in this process? Because they bear the same issue from their constituency, but we may find ourselves the one who actually is taking care of them.
So I would say they absolutely, there will be a coordinated effort as part of our larger program. I don't want to get ahead of ourselves, but I will say that we are working at all three levels, at the Cook County level, at the Cook County Department of Public Health, and the Cook County Health System are working together as one to create a comprehensive strategy on how we're going to be able to really try to educate and notice and prevent these deaths. And so we will be having an update that we'll be bringing to the board that will have that information.
And we regularly coordinate with IDPH and the other jurisdictional health departments on programs. So,
and we'll even be working with CDPH, we'll be working with IDPH, and we, as we have talked already, we've been on calls with, with both with the federal government and with the state government on how we can coordinate. And so we're working at all levels of integration and communication because this is recognized as a very significant health issue that's going on across our country right now.
and our primary jurisdiction as a health department is in the suburbs.
Yeah, and this is Dr. Rubin. If I could clarify this briefly, that will answer your question. Sorry that there's an echo here.
Go ahead. Can you recognize yourself, Dr. Rubin?
I'm sorry, this is Dr. Rachel Rubin, Senior Medical Officer with the Cook County Department of Public Health. These test strips that we are purchasing is with a joint program with the Chicago Department of Public Health. So our jurisdiction in terms of distributing these test strips are through partners throughout the suburban area, and the city of Chicago is doing the same throughout the city. Where we certainly need to forge conversations with, and we are always in conversation with the other health departments within our jurisdiction, that we don't have, such as Oak Park, Skokie, Stickney, and Evanston. But this particular test strip program is a wide program between Chicago and the suburban area.
Well, unless there's any other questions, Charles, this was the second of the two items, correct? First. Being too optimistic.
Thank you, Dr. Fegan.
Okay, request 2, we're asking to extend and increase the contract with SIMPAR for COVID-19 and influenza mobile vaccine, a $2.2 million increase that is also grant funded and extended for an additional 1 month. This is to provide, continue to provide mobile vaccines for COVID-19 and influenza in suburban Cook County. That's it for the 19 contracts.
All right. So I would now ask for a motion to approve item 4A, contracts and procurement items containing request numbers 1 through 19, subject to completion of review by contract compliance.
So moved.
Motion's been made. Is there a second? Motion's been made and properly seconded. Is there any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? The ayes have it. Charles, you want to move into the MBWB report?
Sure. Yes, sir. Okay, before you, you have the report for the contracts that was brought to you with the month of May. The second column from the right, I should say. 17 contracts total came before you. Only 5 of those had contract-specific goals for $7.7 million. Of that, 2 of those vendors were prime contractors for $4.1 million total, approximately 54%. And 2 of those vendors were subcontractors for $134,000 total. For the 5 vendors, $4.2 million, approximately, for about 52%. Unfortunately, and I always like to say unfortunately for waivers, because I do not like waivers, we had 1 full waiver for $3.2 million. The contract that we presented to you for physician recruitment services on behalf of Clinical and Human Resources ended up with a full waiver. Moving to the right, year to date, 31 contracts, a little bit over $175 million. 7 of those were prime MWBE vendors, $21.9 million, 12%. 18 of those for $47.2 million were subcontractors, 27%. So 25 contracts total, a little bit over $69 million of participation there, and approximately 39%. And again, six full waivers from year to date, 7.5 million. Next page, Debbie, for the bar chart visual. So 56% for May, 39% year to date. But you know, I don't get too excited about 56%. It's just a small sample. I always like to say, Chair Ryder, we'll continue. We're always working hard on it.
All right. Any questions for Charles? All right.
I have a question, not about the contract process per se, but I'm sitting here thinking, Charles, do you all ever conduct surveys with subcontractors about their relationships with primes in terms of, you know, how they get along, and, you know, are they satisfied, are they being treated, you know, fairly, et cetera, et cetera? Do you ever?
Yes, sir. We do not, on behalf of health system, but the Office of Contract Compliance for the county underneath the Office of the President does do that. They do field surveys and they do interviews.
Okay, so that's
yes,
the office.
yes. And we have talked a while ago about having the Office of Contract Compliance come and present to this committee at some point.
Yeah, I just, you know, once again, you know, the subs, their cash flow problems, you know, they don't have credit lines, and I just think about the low person on the totem pole and how they're treated, and so I'm advocating for those individuals, you know, those subs, and
yes,
their cash flow and how they're treated.
Yes, the Cook County Office of Contract Compliance has a close pulse on that.
Thank you.
Right, you're welcome.
Yeah, no
Well,
question.
and I
Redirect my question.
have a piece to add to what Otis said, and I'm wondering, you know, when
Dennis,
you
we
have,
can barely hear you. Dennis, we can barely
you hear
hear
me
you.
now?
Can you speak up?
Can you hear me now?
It's better.
Okay, sorry about that. I just wanted to add in, thank you, Otis, for bringing that up. I think it's important for us to do those type of surveys, and definitely have the Department of Contract Compliance come and present to this board. I was talking to a couple of constituents who have businesses, and one of the primes said to them that they could get paid faster for a 1% charge. And I kind of winked my eyebrow at that. I know that has been a practice for some, but I know that's not something that we would, as our board, agree with. So I'm just kind of putting that out there, because they should be getting paid on time anyway. We put that out there legislatively, that a sub should be paid from a prime, a sub that's an MBE should be paid by a prime within 30 days of receipt of that prime's check. And so, you know, for a prime to say, hey, you know, we can't pay you within 30 days, but if you pay us 1%, we'll get your money to you faster. I think that doesn't make any sense whatsoever. So just kind of putting that out there. We do need to hear from contract compliance, but certainly need to streamline how our primes are treating our subs.
So there's, I don't know, in different parts of government, there's laws and ordinances around prompt pay. So I think that's probably a more complex issue that we would have to look at, and would also depend on the flow of money just generally too. So certainly something we could take a look at. Usually though, it's making sure that government pays their bills, getting involved in the relationship between the prime and the sub could get a little bit trickier legally, and our ability to actually, regulate that through contract or through ordinance. But I think to the extent that it could be done, it would probably need to be done at the county level with all primes and subs, and not just through here, because there'd probably be an equal protection. There'd be an equal protection issue, potentially.
Yeah, what I would say is,
it actually comes through the Department of Contract.
what I would just add, the reason it routes through the Department of Contract Compliance is because the lens is whether or not they are meeting the representations they have made to the county to have MBE participation and who they have selected in the process. And they have a scope. We have to make sure our involvement in what we do is not interfering in their ability to run their affairs, or that we're not circumventing our own procurement processes. And so that's why the Office of Contract Compliance makes sure that when someone represents to us, that they are having a certain amount of MBE participation as we require when we put out solicitations, that they are actually meeting that and they're delivering on the ability to be able to do that. So I think we can make sure that we work with the Office of Contract Compliance to come in and give a briefing to our board on what we can do and how we can ensure that they're meeting the requirements and the representations they have made to Cook County Health or to the county in engaging in the contracts with us. And so those are some questions. So we can schedule for a briefing for them to come in.
Well said, Israel. Thank you so much.
Also, I say too, where I would defer to the Office of Contract Compliance for a formal and official answer to you. Within the contract as well, there is a utilization plan and a letter of intent that has payment terms on it, signed by both the prime and the subcontract as well. So they should be following that for payment terms.
So you said that's part of the routine?
Yes,
That's part of the
within
contract. So that's where they monitor contract compliance, is that the contract compliance will ensure that anything that was part of the contract is being adhered to.
And those documents are notarized, so if anyone's doing anything outside of it, it's in, contrast to what they've agreed to contractually.
And to what you were saying, Jared, is that that's an issue between the prime and the sub.
Yeah, so, I mean, it's an issue of contracting and how far deep into you can go into that relationship between two parties is, I mean, you have the ability to weigh in, but it's a more complex issue probably than what it would look to be on the surface. I only know that because I'm a lawyer, but I'm not a lawyer for this body, so I would ultimately defer to Jeff and his team. Alicia, we don't want to catch you flat-footed either, so.
No, this is Alicia Patel, Assistant General Counsel for Cook County Health, and you are correct that it is part of there are certain terms in our contract that we ask to flow down to the subcontractors, that it would be a contracting item and most properly at the county level versus the Cook County Health level.
We're an oversight body, not a legislative body, which I think gets there's some overlap, but there are some distinct differences.
So that's actually what I'm saying. I personally sponsored and legislated an item that calls for it. So it's along the lines of prompt pay, and the prime must pay that MDE, in particular women in MDEs, within 30 days. And we kind of overhauled the system at the county level with Mr. Lawrence Wilson, with procurement, et cetera, to make sure once invoices are received, that they go through a certain process that should be about 15 days. So it's not sitting on anyone's desk, which helps us to meet or beat the 30-day deadline. So that's in effect. Anybody that wants a copy of that, let me know. I can send it to you. I will make sure that Jeff has one as well, so that we know that. But it's in order. Yeah,
I think though, if if there's a relevant ordinance and it's to be enforced, then they have to be enforced by the subcontractor against the prime, with whatever mechanism it is, and ultimately it would ultimately go to contract compliance before it would come here.
Agreed.
All right, Charles.
Okay, 2 emergency purchases for the month of June, both issued on June 16th, to the Chair of the Board and the Chair of Finance. First one is with Optum 360 LLC, 12-month contract on behalf of the Department of Revenue Cycle, vendor to provide license for ChargeMaster database, $81.6 thousand. Second one on behalf of the Department of Quality Assurance with Q-Centric LLC as the vendor. Again, 12 months for this one as well. Vendor to provide extractions for all charts extracted core measures for Trojan Providence Hospital, $142,000. Any questions on emergency purchase?
Any questions on the emergency purchases? If not, Charles, thank you.
Thank you.
All right. Next up, we are going to have a report. Our Chief Financial Officer, Pam Casara, is not here today, but she is remote, but I believe Scott Spencer, the Associate CFO, is going to be reporting for us today on the financials. But first, I think we have the grant award related items, right?
Yes. Good morning. So before you, we have our receive and file report with 14 programs on it for a total of $5.7 million. Breaks down to about $3.4 million of renewals, $2 million of new awards, and a couple $100,000 of amendments. So of those 14, the top 3 items, $2 million in support related to support services to asylum seekers, $1.6 million related to WIC, and $1.1 million related to substance use disorder treatment, prevention, and recovery services. The other items, the other programs, or any specific questions related to those can be addressed to the executive sponsors, if there are any.
Any questions? Hearing none, is there a motion to receive and file 5A grant award related items?
So moved.
Motion's made. Is there a second? Motion's made and properly seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye. Aye. Opposed? The ayes have it. All right. Let's go ahead. Scott, you have the May fiscal year 2023 financials?
Yep. Yes, sir. All right, so on a year-to-date basis, on an accrual basis, we're just under $216 million favorable. On a cash basis, just under $75 million favorable. The explanations there continue to be what they've been the last few months. Net patient service revenue, or NPS, are favorable to budget due to higher than budgeted inpatient volumes and directed payments, as well as a retroactive rate increase from Medicaid. In addition, we're favorable in terms of capitation due to the higher than budgeted county care membership, that membership being over 450,000 at the end of May. So the health plan coming in $2 million favorable variance to budget. On the expense side of things, county care claims unfavorable variance to budget, again, due to that same, excuse me, due to that same higher than budgeted membership. Next slide, please. So walking through our income statement here, draw your attention to the total revenue line. So $423 million favorable to budget, which is split fairly evenly between the NPSR and the capitation revenue. And then down in the operating expenses, drawing your attention to the medical claims expense that's unfavorable, 206 million, again, related to the higher than budgeted membership. Next slide, please. So in terms of volumes, favorable on the inpatient side, unfavorable on the outpatient side, favorable on the, in terms of surgeries, on the ACHN side of things. We are unfavorable in terms of primary care visits, however, favorable in terms of specialty care visits. But in all categories, we are better than we were, a year ago. Next slide, please. So again, same information, just shown graphically here, and we can see for the most part, with the exception of ED, we are back to pre-pandemic levels. Again, with the exception of ED. Next slide, yes, payer mix. So we know that our Medicaid payer mix has increased over the last 4 years as the uncompensated has decreased. We've also seen some growth on the commercial and commercial payers as well. And we'll see how redetermination impacts our payer mix sometime in the probably September timeframe. Next slide. So revenue cycle, key performance indicators, just drawing your attention to the cash collections. We had a bit of a dip in the month of May. However, well above the target, so good news there. Our AR days, which gives us a peek at the health of our accounts receivable. AR days, both greater than 90 and in total, were either at or better than target. Excuse me, better than target. Next slide, please. Yeah, so denials continue to trend in the right direction. The detail here gives our rev cycle team the information that we need to refocus the efforts and tackle whatever the issue happens to be in any given month. But as you can see in the net final denials in the top right-hand corner, despite the uptick in the month of May, still better than the target of 2%. Next slide, yes. So charitable and public program expenditures, projecting to be over 400 million for the year. So pretty much in line where we were for fiscal 22 and budget, both in terms of total dollars, but also percent of revenues and percent of costs. As far as savings initiatives go, 50% through the year, we're at 34% of target. Focusing on the items that are in yellow, there's nothing there or no immediate concern that those won't turn green by the end of the year. And last but not least, health plan services. So county care, again, the 2 million margin that I had mentioned earlier compared to a budget of 0. And as you can see, the monthly membership continues to be favorable to budget, which we expect to see up until that August, September timeframe. So happy to take any questions you may have.
I have a question, I think it was page 4. I'm curious, when I look at the primary care visits and I see the negative number, can you explain that to me?
I can. The primary care visits, we looked at we're basing them on continued growth. What you can see is that 2023 is actually larger than 2022. We were aggressive because we wanted to empanel new members. We have had some of our physicians leave, and we're in the process of hiring new primary care physicians as well as expanding in primary care. So it is a growth, but the negative is compared to our budget that we were hoping to be a little bit more aggressive with primary care, but we are over last year. So last year at this time, 22 was 108. And so you can see that, we are at 117. So it is a growth from previous year, but it's a little under our target of where we want it to be.
Okay, thank you. Any other questions?
I have a quick question, for information. On page 10, Scott, it's just a quick question about the budget impact for fiscal year 23. On the revenue cycle, are those the same listed items as for fiscal year 22? And you just changed the target?
I am gonna defer to Curtis on that. If, Curtis, did you hear that question?
I did. I didn't know if you, had the footnotes on that one, but, to answer your question, yes, they are, the same initiatives, but with new impact numbers, that we were expecting for fiscal year 23. And there's one additional one there, which was the coverage, accuracy one. That one is added new, net new for 23.
Thank you.
All right.
Absolutely.
Any other questions? Hearing none. Thank you, Scott.
Thank you.
And that brings us to the end of the meeting, so we can get out of the way for the next committee meeting. The agenda has been exhausted, so we are adjourned. Thank you, everyone.
Thank you.